Our two primary choices with stones, essentially with stones that are within the ureter, that are the most common type within the kidney tube causing blockage, would be either shockwave lithotripsy or endoscopic or ureteroscopic treatment. The first treatment involves a non-invasive sound wave machine that generates a sound wave that we direct through a water interface that's brought up against your skin, and we're able to non-invasively direct those sound waves right to where the stone is within the body. We target the stone using X-ray, real-time X-ray, and we're allowed to, essentially then to deliver the shock waves right to the stone, pulverize the stone right inside the urinary channel, and then allow those fragments to pass on their own harmlessly. For some stones, we also can apply what's called ureteroscopy or endoscopic treatment. This requires an anesthetic as well. What this involves is usually putting a metal instrument, what's called a scope or a ureteroscope, into the urinary channel, into the bladder, and up inside the ureter, the urinary tube, where we can then access the stone and either remove the stone by pulling it out or use devices such as a laser to break up the stone within the tube and then remove the fragments. Oftentimes afterwards we'll put in a temporary internal tube within the kidney called a stent that will stay in for several days after treatment and then will be removed in an office setting at a later date. That's an internal plastic tube that is inserted into the urine channel after the procedure. Often we will insert it because when you do invasive treatment with the scope, when you're in there in the tube with the metal instrument, you often get a lot of swelling and you can get some trauma to the internal portion of that tube. And after you remove the stone, you can get some swelling and bleeding and even some blockage of urine from the swelling. So often what we will do is after we remove the stone, we will put in this temporary tube. It starts up in the kidney and it runs down the ureter into the bladder, and it essentially keeps the urine flowing as the ureter heals after the instrumentation. The only drawback with the stent is that it has to be removed at a later date. That usually involves going in an office procedure with a scope while you're awake into the bladder and grasping the stent and removing it completely, usually about a week to a week and a half after the surgical procedure. Known to have some discomfort. It is a foreign body. It's sitting within the urinary system. The primary complaints appear to be one of some occasional spasm in the flank or groin. Occasionally we also have bladder overactivity or bladder spasm from the fact that the bladder has the stent lying within it, and it causes the bladder to have spasms and a feeling like you have to urinate. That's one of the most common types of symptoms we notice. Occasionally we'll have some bleeding as well from the stent if you move around, for a great deal of time, after the treatment.